Welcome to SPD DLS, Sterile Processing Department's Dirty Little Secrets, and the CS Guide. As our industry becomes more regulated, certification is becoming mandatory in most departments and in some states. Many persons entering the field and experienced technicians are faced with fear and trepidation when it comes to studying for and taking the CRCST examination. They have questions about the best methods to follow to succeed at the exam. Hence, this video is on how to pass the CRCST Certification Examination. Be sure to have your study materials at your disposal, whether they be bought or loaned. The most recent edition of your study manual will give you the best chance to pass the exam. So you managed to acquire the textbook, but no study manual. Don't worry, you can still pass the exam. You will need to take a brief overview of what you're about to delve into. Review all your study materials. This will get you started on the right foot. It is incumbent upon you to develop a study plan. Understand your body and the times of day or night you can devote to studying and retaining the best and the most information. Conflicts may occur, such as your work hours and other activities. Create a schedule that you can maintain. Read and understand the objectives at the beginning of each chapter. The objectives are a guide to what the chapter is about and what you are expected to take away. Have the essentials ready, such as pens, highlighters, and notepads. This will definitely help with remembering text and taking notes. Read the book. Many experienced technicians assume their years of experience alone will be enough to pass the exam, which is a big misconception. The terms used in the study material may not be the terms used on a day-to-day basis. There are 24 chapters in the Central Service Technical Manual. You can strategize the way in which you read the chapters. You can read the chapters by length, which will get you acclimated to long periods of reading. These chapters cover the world of sterile processing, biology, anatomy, along with medical terminology, regulations and standards, decontamination, instrumentation, assembly and packing, forms of sterilization, and risk management. Pay special attention to the green boxes located in the manual. The information in these boxes are directly related to the questions that you will be asked in the certification exam. Test yourself after each chapter. Periodical tests will help you become more comfortable in an exam environment. Practice tests will help you pass the examination. If you are taking a class, work with your instructor to provide you with information you need that will allow you to be successful. A good instructor will work with you, taking into consideration your learning style. Communicate with your instructor. If the class schedule, pace, and outline do not meet your expectations, it is your money, your investment. Be firm about what you need. An 80% pass rate in your practice test will give you enough of a buffer to succeed at the certification examination, where the pass rate is 70%. Always aim for 100%. Read the glossary of terms. Chapters 3, 4, and 5 feature key concepts and techniques that are covered in the examination. Here are a few resources. This will help you study, find useful information, and the practice test. Quizlet, ProProofs, Crazy for Clean, Steris University, Isham, YouTube, and Google. Do not be afraid to fail. If you do not pass the exam, try again. Stay disciplined and consistent with your study habits. It is important to network, to get a feel for the field from others who have been there for some time. This may open up job opportunities in the future. Spend money on seminars and invest in your future. Schedule your exam within 30 days of completing your course. If you lack motivation and experience anxiety, schedule your exam before you are ready. This will give you a deadline to work towards, and ultimately these steps will help you secure your certification card. Thank you.